It's a very interesting situation because we have a problem specifically with the diagnosis. It's the first difficulty, the challenge that you have. And after the diagnosis, we have another situation that is about the stratification of these patients, because the access to the NGS and the molecular stratification is sometimes a problem. Only about 20% of the centers has access. And after this, another problem, you have in Latin American 20 centers, 20 countries that have bone marrow transplantation. And we made a survey, and you have the answers from 12 centers. You have 14 centers that do have bone marrow transplantation. And from these 12 centers, only 50 perform unrelated donors, transplant with unrelated donors. And that you have the restriction of the options for these patients. And then another very important thing is that the median age of the patients from Latin America are different from the United States and Europe. The patients are with the median age in Brazil is like 61 years, and in whole Latin America is about 55 years. It's probably related with the exposition of these patients to pesticides, or something like related with the occupational realities of these patients. And then we should try to improve the access to bone marrow transplantation, because it's the only curative approach that we have. And we should discuss this with the centers, improving the diagnosis, stratification, and access to the bone marrow transplantation.